Good afternoon, and thank you for joining us. Today is Monday, April 27th, and we're here to give you the daily update of about the Riley County coronavirus situation. My name is Vivian Uccello. I'm the Public Information Officer for the City of Manhattan. Joining us on the broadcast today, we have ASL interpreter Tony Kroll. We have Andrew Adams from the Riley County Health Department, as well as Julie Gibbs from the Riley County Health Department, and Kurt Muldrip from the Riley County Police Department. Thank you all for joining us. Julie will give a brief statement and then we'll have some time for question and answer. If you have a question for anyone on the discussion today, please leave it in the comment section and we'll answer as many questions as we can in the time allowed. And if we don't get to your question, we'll come back later and type in an answer in the comments. So Julie, can you give us today's update, please?
Sure, Vivian. Hi, everyone. As of today, April 27th, there are now 3,328 cases in Kansas, with 496 hospitalized and 120 deaths. Riley County now has 45 confirmed positives, and 21 of those have recovered. The most recent individuals to test positive are females, ages 35 and 23. Both individuals are recovering in isolation in their homes. We also have 9 tests pending, and there have been a total of 359 negative tests in the county so far. In an effort to determine how many people in Riley County have or have not been infected by COVID-19, we have collaborated with other health department partners to develop a survey that will be pushed out on our social media channels and our website. Whether you're experiencing symptoms or not, we encourage you to fill out the survey so we can better understand the percentage of those who are experiencing COVID-19 symptoms. This will hopefully allow us to expand our testing even more. This survey is available throughout the week. Please only fill it out once and be sure to read the instructions before you do so. If you have questions, don't hesitate to reach out to the health department. If you are experiencing symptoms, please call our screening line at 785-323-6400. This is available every day from 8 a.m. until 10 p.m. Again, that number is 785-323-6400. We are still encouraging anyone with questions to email us at rileycountycovid19@gmail.com. During business hours, we are usually able to get back to you quickly. Again, that email is rileycountycovid19@gmail.com. We are currently working on a step approach plan to open up Riley County. This will be very dependent on what the governor decides to do, and will also be very dependent on our situation here in the county and in the region. We are following guidelines from a few different sources, as well as gaining input from our clinical task force and other county and city partners. This will be a trickle effect, opening with many safeguards in place, if that decision comes down to the local authorities. Please know that we place the community's health and safety as our first priority. With nicer days ahead of us, please continue to practice social distancing. Wear a cloth mask when you need to, and take care of yourself. It's important that we stay home unless we need essentials, at least for a little while longer. Thank you for your support and cooperation.
Thank you, Julie. I know it's kind of early to make this determination, but when you talk about social distancing measures being needed for the immediate future, do you have any idea what the timeline for kind of making changes to the county situation, what that might look like?
Sure. With all of our phases that we're working on, it's at least 14 days, if not longer. Of course, we'll have to look at the situation and what that brings within those 14 days, but every phase will be lasting at least 14 days.
So if the governor's order does expire at the beginning of May, if I'm understanding correctly, you're saying that it's still going to be probably 14 days at least after that point before Riley County would see kind of a loosening of restrictions. We'd have our own stay-at-home order in place. Is that correct?
Absolutely. We have our own version of a stay-at-home order in place with our own safeguards in place. And yes, every phase that we will go through will last at least 14 days. We will open a little at a time. Like I mentioned, it will be a trickle effect. That
Okay,
will be
thank you.
determined on our situation.
Okay, thank you so much. You also talked about the community survey that just launched today, and Andrew had a big part in designing that and getting that ready for the community. Andrew, can you talk a little bit about kind of the purpose for the survey?
Right. So we really want to get a better understanding of the overall impact of COVID on the community, not just in Manhattan, but countywide. And so, we've been monitoring our Facebook, the phone line, the email address, all those things, and we've seen a lot of comments about, well, we really want to be tested, or we think that we should be tested, or how come we haven't been able to be tested? All those questions. And so, we wanted to release the survey to try and get a better understanding of really just people that have had signs and symptoms of COVID, and really what that impact has had on the county at this point.
And how many responses have you had so far, and how many are you hoping to get?
Sure. So I looked right before we got on, and we were right around 850, 860 in half of an afternoon. So that's fantastic. I didn't want to set a solid number in terms of, we'll cut it off at this point, we'll do this, but leaving it open for the next few days or so, or the week, and really seeing where we're at and going from there, I think would be really beneficial. It'll help us get a good kind of cross-cutting, look into the county and how we can move forward based on those results.
And kind of the goal is to have the more people who respond, the better, or the more accurate the picture will be, correct?
Correct.
And why do you want people who are not symptomatic to also respond to the survey? What does that tell you?
Yeah, so again, it really helps to try and find the numerator and the denominator for what we're trying to look at in terms of the impact of COVID on the county. So right now we have a pretty small sample size, right? We know the people that have been tested, and we know the people that have tested positive and the people that have tested negative. But outside of those, few hundred folks, there's a lot more people in the county than that. And so if we can find out, if you're healthy, if you're feeling well and you answer the survey, versus if you're ill or you have been sick and you answer the survey, it helps us kind of even out those numbers a little bit more and give us a more stable number to base some of our disease modeling and our predictions off of, and might help us moving forward.
If someone does report that they have symptoms and maybe haven't been tested, will they be contacted by folks at the health department?
Potentially. So we're looking at the best ways to do that. So we want to make sure that it's clear that this survey does not, take the place of a medical evaluation or a call with your doctor, or serve as a diagnosis of illness. It's really just a way for us to gather more information, more relevant information from people throughout the county. So there's a chance you would be contacted by at our CHD for follow-up. We're going to look to do kind of a random sampling of those respondents to really see where we're at, like I said, countywide. So even though you might say, yes, I have these symptoms, or no, I don't have these symptoms, you may or may not be contacted. But just want to make sure that it's clear that this is for informational purposes. This is not a guarantee of being tested. It's not a medical evaluation. It doesn't take the place of your doctor or the screening line or anything like that.
Okay, so your best advice is still, if someone has symptoms, you'd like them to call that screening phone number, and I'll give that number again. It is 323-6400. That's 323-6400. That's the number to call if you are experiencing symptoms of COVID-19, and you'll be able to speak to a nurse with the Riley County Health Department.
Correct.
Also, speaking of data, we had some data over the weekend that our social distancing score fell pretty significantly in the county. Over the weekend, we scored an F. We are back to a C, and that's kind of measured by cell phone companies, the amount of travel within the community. Kurt, can you talk about what your officers saw over the weekend?
Yeah, we definitely got an F this weekend. Friday we did good, but Friday we had a lot of rain, and then Saturday the crowd started to get out, and I did see myself a lot of people out walking, doing the things that we want them to do, enjoying the weather, getting some exercise. But as the day went on, we started to, as a department, started to receive calls as well as have officers see situations where those house parties that I warned about were starting to grow, and that's exactly what occurred. So officers made contact with a lot of different residences where house parties or gatherings were starting to grow. Some of the calls we got complaints on ended up not being too large, greater than the 9 or the 10, and we had good distancing there. But we did have a few parties that were growing larger than that, and were becoming a problem. Then we had our typical spring calls for motorcycles and groups out kind of racing around town, et cetera, and they tend to then park and congregate together. So all those things need to we need to take into consideration that the governor's order still applies. Something I've noticed is there's a lot of talk, I think, in social media and just conversation that it's about to end this week, and there's this feeling that, hey, everything's going to open up. And as Julie covered, that's not necessarily the case. We, one, don't know if she's even going to give it back to the local officers to make some decisions, but also if she does it, what kind of restrictions she'll continue to have. So it's important for everyone to remember this weekend isn't the weekend it's all going to come to an end. We need to stay the course, continue to stay at home. I know that we've had some of the positives that we've seen have been due to the interaction of the community together. So folks need to maintain their social distancing, and we need to control those house parties. We again, as I emphasized last time, we, if necessary, will issue citations for those that continue to want to violate the order. And again, it's a last effort on our part. We want to work with everyone, but if necessary, we'll have to take those actions.
And it's still our best advice not to interact with folks outside of your household. I know you mentioned, groups of fewer than 10, not necessarily a kind of an actionable offense. But Julie, can you talk about some of the kind of social distancing advice that's with us now and probably will continue quite a ways into the future?
Yeah, so like we've said, try to stay that 6 feet away from another person. When you're outside, if you're walking with somebody from your household, that's fine. But try not to go on a walk with other people or large groups of people running together. That's not a good idea still at this time. If you're going to be in a place where social distancing is hard to maintain, you'll want to wear a cloth mask. And we have partnered with Westview Community Church for our mask donation and distribution. So if you need a cloth mask, it's very easy to access. Mondays, Wednesdays, and Fridays, you can go there anytime from 11 until 3, or Saturdays from 9 to noon and pick up a cloth mask. You can also make your own. We have instructions on our Facebook page on how to do that. So it's not hard to acquire a mask. And that's just a good practice to wear that when you're going to be in an instance where social distancing would be hard to maintain. And then I mentioned it on Friday's Facebook Live, just these new practices that we're adopting along the way, maybe not shaking hands, but instead acknowledging each other with a nod, something like that, that could be a lasting trait that we can continue on like that without having to expose each other. So I think just maintaining that social distance, keeping that all in mind from here on out, not just in this time.
Okay, thank you very much. I want to shift gears and talk a little bit about testing. Can you give us some information about how things are going at that swabbing station that's been set up?
Yeah, so things are going well. Last week we saw a little over 20 individuals, and we just started on Wednesday. So I haven't seen how it's gone today so far. I haven't taken a peek out there, but I think things are going well. The protocol is working. Again, we want to remind people to call the screening line first, and that healthcare professional will direct you in the right direction based on how you answer their questions.
And Andrew, did you have anything to add? I saw you nodding down there.
No, I think she's exactly right. So I know there have been a few that have come through today that I've seen. So it seems to be working well.
Okay, thank you very much. In terms of the availability of testing materials, swabs, and other materials that make that possible, can you talk about kind of the relationship with KDHE for those supplies? We've gotten reports that they have increased testing supplies and they are sending those to counties. Have we been receiving those? Can you talk a little bit about that?
Yeah, so we've received some from KDHE starting last week. We've received more testing kits available to us, and we know that they are getting to the counties where they're needed, where we've seen those outbreaks. Those are the first counties that they were able to send those to, but we do have supplies coming to us as of right now. And Andrew, if you want to add anything to that.
You're exactly right again. So we did receive some supplies from the state last week, and so we're working through using those and the best way to utilize those resources. And like you said, Julie, the state or the counties that are being hardest hit right now are taking a little more priority because they're being so hard. They're being hit so hard. But we've received some supplies from the state, and I think right now we've got adequate supplies for what we need, at least right now, before we move forward.
We saw a big jump in the numbers reported for negative test results received today. Can you talk a little bit about that?
I'll take that one. Sure. There was a bit of a delay with one of the larger private labs the last about week and a half or so that led to a delay in reporting of those test results. So that's one part of it. Another part is the way that we receive those results through our different systems and things. There's always a little bit of a delay with that as well. And third, we're seeing that increased capacity, whether it's here at the health department, whether it's through the other providers and other facilities in town. We're able to reach more people, to test more people, and so that is reflected in those numbers. So it was a big jump, but there are a couple different things that factored into it.
And it's good news that it's the negative column that jumped up, right?
Great news.
Yeah, very good. I'm going to switch gears here again one more time. We've talked kind of over the past few weeks about this idea of an alternate care site. Can you talk about the status of that? Is it moving forward? Is it needed right now?
Yeah, so we do have plans for an alternate care site. So we have a location, we have that mostly ironed out for when we need it, but right now we don't need it. And that's a good thing. We're hoping that we never have to need that, but we know that we needed to plan for something like that in the event that we do need that. So that would serve as a skilled nursing site. Individuals who might be first responders or healthcare providers that need to quarantine, they might need to be put there. It would also serve as a swabbing site, respiratory clinic. So it could serve many different purposes, but right now there is no need for that in the county. When that need does arrive, hopefully it never does, but if it does arrive, then we can access that.
Okay, and so nothing's really been finalized at this point. There's no contract, there's no plans to open. Okay.
Right, no plans to open.
Okay, thanks for clearing that up. The last question, someone on Facebook asked about, since we are very much a regional community, we've got people who travel in and out of Manhattan for work or for other needs. Are we kind of balancing our approach to that gradual reopening with other counties as well? And how's that working?
Yeah, so we have a good relationship with our partner counties. So Geary County and Pottawatomie County are two that we've been in communication with about this. And we've actually been in communication with them on other orders as well, so that we kind of mimic the same thing, that we're not seeing something different right when you cross the county line. We actually have meetings with them tomorrow morning as well to talk about those orders, and hopefully so that we're all on the same page with those orders and that we're mirroring each other.
Okay, thank you so much. Kurt, when officers do have to go out, maybe approach a house party or a situation where people are in violation of the stay-at-home order, what's your advice for them?
for the individuals we're making contact with.
Mhm.
One, understand we're doing our job out there. No, the officers that do that, this isn't a fun thing for them to do. And honestly, I think, everyone has their opinion on where we're at on this and what we should be doing. Unfortunately, the order's in place, and that's the rule of law, so to speak. And so they need, I think, understand that this is for everyone's good. I think people, again, need to remember that this isn't about them. It's also about the community and the spread. And I know that some people could even have the virus and not feel all that uncomfortable, sick, etc. The concern still is that they could be spreading it to someone else that is vulnerable. So we're trying to protect that vulnerable population, especially. So the less people that have it, the less likely it is to get into that vulnerable population. Then we have our health system overwhelmed, et cetera. So I think that those things are obvious. So as officers come and deal with it, I hope that everyone understands they're doing their job and doing this for the community. And we'll help them remember. We show them the rules, because sometimes there's confusion. There shouldn't be by now, I wouldn't think. But then again, if necessary, a citation can be issued to not just the host, but the participants as well. And so everyone needs to remember that they can be in violation by attending that kind of an organized group as well, or unorganized.
Thank you very much. I know it's kind of not, being the fun police is kind of not what we want to do, but it's very important for the health of the community at this point. Let's see. Andrew, we talked a little bit about before the broadcast started and kind of earlier today, kind of that age group that has the highest number of positives here is kind of younger than it's been elsewhere in Kansas. Can you talk a little bit about that for us?
Yeah, I think that's really reflective of our community itself. So when we look at our overall age countywide, we are lower than several other places statewide. And so I just think if it's a higher proportion of the community, then it's more likely that there will be a higher proportion of illness in that age range. So I don't think there's a whole lot more to it than that. We've got a younger group. Some people, like Kurt said, they might not feel like they're sick, but they are, or they could be. They just might not be as sick as someone who is more vulnerable, who is in that advanced age group. But I think it really just comes down to a numbers game, that we have more people in that 20 to 34, 18 to 34 range, and that's where most of our cases are at this point.
Okay, do we have any final thoughts for the community, or any questions from the media at this point? Haley, go ahead.
This is Haley with the Manhattan Mercury. I think this is a question for Julie and Andrew. Why does Kansas have more tests now, and how did KDHE get more? Thank you.
Sorry, Haley, could you repeat it?
I can repeat that for you.
Okay.
Haley from the Mercury wanted to know, why does KDHE now have access to more tests, and potentially, do you know where they got those supplies?
So I can say that from the tests that we have gotten from KDHE, of course, we all know there's been a shortage of tests in the nation so far. So it's not that they're hoarding tests there. They acquire those and they give them to the counties, especially the ones that that need them the most. So I've mentioned before, we talked about the counties that have the meat packing plants that have individuals that are close together. They need that testing to be done. That greatly affects that whole community. So we need to get tests down there as quickly as possible, and any other outbreak for that matter, not just those places. So when the state does get the tests, they give them to the counties that are most in need. And of course, we did see some as well. And hopefully we will continue to see more test kits available to us in the future. Andrew, I don't know if you have any more to add.
Yeah, I think you're exactly right. Again, so it's just a matter of placing or supplying tests where they're most needed based on the situation on the ground. So, so far to this point, we've had a relatively low number of cases compared to others, and and knowing where the needs are, where those outbreaks are popping up, is where most of the testing supplies go.
And we don't necessarily know the supply chain for KDHE. It's possible that this was, the manufacturer had more to supply, and they were able to get some from the national supply of tests. We are grateful that it's happened, and we're going to take full advantage of that here in the community and test as many people as we can. Let me check Facebook one last time to see if there are additional questions. A specific question about dentists. If we know when dentists will be reopened, and then kind of a second part to that, do we know for sure what the governor's plans are?
We do have word that dentists would like to go ahead and reopen on May 4th. Of course, there are going to be certain restrictions in place, so it won't be just like normal. They will have restrictions in place. As of now, they're still operating as they have been for about a month or so, just doing emergency procedures. But many dentists, I believe, will go ahead and open on May 4th. That's as far as I know right now. Of course, like I said, there will be restrictions in place. And what was the other part of the question, Vivian?
Have we had any word from the governor's office about whether or not she intends to extend the order? Are we waiting for that information?
We're still waiting for that information.
And who will make the determination about whether or not dentists can reopen?
That may be determined, maybe dependent on the actual dentist office. It may come from higher up. I'm not sure.
Okay.
It's my understanding that the dentist offices are exempt, and it's a decision they're making, but I think they did it corporately. And so I think you'll find corporately they're going to work as an organization on ways to reopen in a safe way.
Okay. Thank you so much. And thank you again for taking the time to provide these updates for the community. We will be back again tomorrow at 4:15 on Facebook Live. And again, if you are experiencing symptoms of COVID-19 and would like to speak to a nurse at the Riley County Health Department, that phone line is open until 10 p.m. each night. And the number to call is 323-6400. That's 323-6400. If you're having an emergency issue, always call 911 first. Thank you very much for joining us.